Hey dolls and gents, thank you for tuning in to my channel. If this is your first time tuning in, welcome. My name's Ashley. So this video is going to be a registered nurse nursing school Q&A. I posted a video on YouTube and a picture on my Instagram about 1 to 2 weeks ago, and a few of you all left me questions. I think have about 20 to 25 questions to answer. So I don't want this video to be super long, so I'm just going to go ahead and get right into the questions. So the first question is from Sophia Sapphire. She asks, can you give us study tips that helped you in nursing school, as well as tips on how to stay organized? Hey Sophia. So to answer the first part of the question, tips that helped me in nursing, study tips that helped me in nursing school. So I pretty much use the same method for each class. I would study the PowerPoints, make sure I read the chapters. Now I know a lot of people don't like reading, especially since those nursing textbooks can be really thick, and like one chapter can be 100 to 200 pages long. But for me, I knew I had to read the chapters that were going to be on the test, because that just helped the information stick better for me. So I would study PowerPoints, make sure I read the chapters assigned for the test. I made flashcards of each slide in the PowerPoint, and I also did NCLEX style practice questions pertaining to whatever we were being tested on. So I would try to find, if we were for MedSurg, if we were getting tested on cardiac, neuro, and the endocrine system, I would try to find NCLEX questions for all of those systems, and I would answer them after I studied each section. So the key study tips for nursing school that I use: study PowerPoint, make flashcards, read your chapters, do NCLEX style learning questions. The next part of her question asks, how did I stay organized in nursing school? So the first thing, the major key alert for nursing school is that you need to have a planner. A planner is very important, so you can write down when you have clinicals, when you have tests, when you have assignments due, or anything else. Having a planner so you can see what is going on, having a planner is essential. I always had binders for specific classes. I kept folders. I color coded everything. So having a planner just to get your life in order, and having binders and folders for specific class notebooks, that's really how I stayed organized. Next question is from Ken Love. What are some things that look good on a nursing school application? When did you know you wanted to be a nurse for a living? How did I make it through nursing school? So to answer the first part of the question, what are some things that look good on a nursing school application? Your GPA, whether you're going straight from high school to university or community college or whatever, so having a good GPA. Volunteer hours, whether you're volunteering in your community or at a hospital. So I think nursing schools, they want a well-rounded candidate. So nursing schools want a well-rounded candidate. So just make sure you have a good GPA, you're involved in extracurricular activities, you have volunteer experience. If they ask you to write an essay about why you want to be a nurse or something along that lines, I would write from the heart. I said I wanted to be a nurse because, I wanted to take care of babies. In the city that I'm in, we have a high infant mortality rate. So if there was something that I could do with my nursing degree to lower that rate or eliminate it, then that's what I wanted to do. Second part of the question was, when did you know you wanted to be a nurse for a living? My grandma, she's a LPN. My granddaddy, he was actually a medic in the Vietnam War. So I do have like kind of like a healthcare kind of family background. But I knew I wanted to be a nurse for a living when I was in church. My church kind of raised awareness about infant mortality in my city, And we actually had Spike Lee's wife come to our church, and she talked about infant mortality, because here we have a cemetery called Babyland, which is where they bury dead babies. And I was about maybe 15 or 16 when Spike Lee's wife came to our church and was talking about that, and I was like, you know what, I'm gonna go to college and become a nurse, and I'm gonna come back and help to hopefully eliminate infant mortality. And you know, I'm kind of doing it little by little. You know, I'm a mother baby nurse right now, so I do work with moms and babies, and you know, educating them about different things like safe sleep. You know, always make sure that the baby's on their back to sleep, and things along that line. So I do want to get more involved with that, but yeah, that was how I knew I wanted to be a nurse for a living. And so I made it through nursing school basically through Jesus. I was praying. I prayed a lot. I fasted some, had Bible scriptures. I really made it through because of him, and that's really how I made it through. Jesus. It was some days I cried. Like, nursing school is definitely tough, but with Jesus you can make it through anything. So I made it through nursing school. Jesus helped me make it through nursing school. Another question from Miss Sophia Sapphire. She says, also, how are your shifts? Do you work 3 12-hour days? And how do you unwind when you're not at work? So yes, I do work 3 12-hour days. Unwind when I'm not at work. Usually sleeping, shopping. I need to start going to the gym. Relaxing with my family, but mostly sleeping and resting, because during those 3 12-hour shifts, like, that takes a lot out of you. So just unwind, you know, find some hobbies that you like to do, whether that's working out, YouTube, making music. I mean, you can have a life outside of being a nurse. Because like I said, I only work 3 days. I get 4 days off traveling. So yeah, there's plenty you can do to unwind. Okay, next question is from Bianca Henderson. She says, could you talk about your experience with taking your pre-nursing prerequisites? For example, was it easy? Was it hard? Did you have to retake some classes? What courses did you take? Also, how was your experience applying to nursing programs? Did you get accepted into every one you applied for? And how many nursing programs did you apply to? So my experience with taking my prerequisites. With your prerequisites, they're just like your sciences, math, English. So I did dual enrollment, which is for English, during high school. So I didn't have to worry about that when I got to college. As far as math courses, I took like a statistics course and kind of like a college algebra course. Then for sciences, you're taking chemistry, biology, microbiology. Is there anything else? Chemistry, human A&P. I did my human A&P courses over the summer back home instead of doing them in college, just so I could take fewer hours. But my experience with them was, I mean, with the sciences, they were tough. But with math and those other classes, I didn't really struggle with. But with the science courses, I did. I always made B's in those classes. But especially chemistry. I hated chemistry. I still hate chemistry to this day. I loved microbiology, but and human anatomy and physiology, that wasn't bad. I took human A&P at a community college over the summer, and I took the rest of my science courses at my university. I wouldn't say it was easy or hard. I guess it was just like a part of the journey. Some of the prerequisite classes are easy because they're just like your basic classes, but the classes that you really have to apply yourself to as far as prerequisites will definitely be like your science classes. Next part of the question, did you have to retake some classes? What courses did you take? I didn't have to retake any of my prerequisite classes. She asked, also, how was your experience applying to nursing programs? Did I get accepted into every one I applied for? So I applied to 3 colleges. I applied to the University of Memphis, Ole Miss, and the University of Tennessee at Knoxville. With the University of Memphis, their program, you have to take the TEAS test your sophomore year, and depending on that, you get admitted. They might have changed now, because remember, that was years ago. With Ole Miss, with their nursing program, they didn't have a nursing school in Oxford. So you will spend your first 2 years in Oxford, Mississippi, and then you go down to Jackson, Mississippi, to finish your nursing school. And I kind of didn't want to do that. I kind of just wanted to stay in one place all of my college years. So with UT, I was actually put on the wait list when I applied for nursing school at UT. But by the grace of God, I ended up getting in freshman year. And they also had the option of, at UT, you could get in freshman year, straight out of high school, or you would have to wait till sophomore year to apply for a nursing program. And I'm so thankful and so blessed that I was admitted freshman year, because that took a lot of pressure off of me. Like, yes, I had to still keep my grades up, but officially being in the College of Nursing freshman year, that really helped me out a lot, because it was stiff competition getting in freshman year, and then you had stiff competition trying to get into nursing school at the end of your sophomore year at UT. So I'm so thankful. God, you really looked out for me on that one, getting in freshman year. Next question is from Lisette Gonzalez. She asked, did you ever regret becoming a nurse? Do you plan on furthering your education in the future? Pros and cons of nursing. Is being a nurse more physically or emotionally draining? Do I ever regret becoming a nurse? Not really. I mean, the only other option that I wanted to do outside of being a nurse was being a teacher. But kind of going into your next question, I do want to eventually become a nursing professor. I would definitely love to teach the maternal child health class, or at my school we called it mother baby. At different schools it's called different things. But I would love to teach the women's health undergrad nursing course, just to kind of group everything in there. I would also like to be a clinical instructor as well, so I will have to go back and get my master's. I'm not sure when I'll do that, but I definitely do want to get my master's so that I can teach in nursing. But so really, I don't really have any regrets about being a nurse. I mean, definitely everything, nursing school is tough, it's expensive, so it can't be regretting. If you put all that money into something, all those study hours, all the blood, sweat, and tears that you put into nursing school, I was gonna be sure I wanted to be a nurse. I was not gonna regret anything. So no, I don't regret anything about becoming a nurse. The pros and cons of nursing. So just some cons. Everybody's pros and cons are different. So some cons for me would be having to work holidays, because hospitals never close. 12-hour shifts, because 12-hour shifts are very long and they're exhausting and draining. Some pros with me, I love being able to educate my patients, taking care of my babies and moms, and generally just helping people in general. My coworkers, they make work a great experience. We talk, we laugh. If I have a question, they're there to help, and they pretty much help me with anything that I ask them to. So we have great teamwork on my floor. So the only cons are just, having to work holidays, being away from your family, and 12-hour shifts. Those are the only ones for me right now. And she also asked, is being a nurse more physically or emotionally draining? I would say both, because physically you are having to work long hours. You're on your feet a lot. Sometimes you might not get to eat lunch. Sometimes you forget to pee. Like, you might only be able to pee once a shift. Emotionally, if you're around death a lot, you know, whether you work in ICU, ER, MedSurg, you know, seeing patients die, that can be emotionally draining. Because nurse burnout is very real. I mean, if you haven't heard about it, I would definitely look up what nurse burnout is. So yeah. Being a nurse, you know, we take care of these patients, but sometimes we neglect to take care of ourselves. So it's very important to take care of your physical, emotional, and mental health as a nurse. The question is from Shatavia Dallas. She asked, which one is best, your associate's or bachelor's degree? I can only speak from the bachelor's degree perspective because I have my BSN, but I do know at my hospital, if they do hire you with an associate, they give you like 3 years to get your BSN. So I mean, but you have to figure out which one works for you at that time. So me getting a bachelor's worked for me, but you know, some people, it might not work to get their bachelor's right now. Sometimes they might have to get their associates and then get their bachelor's later. Next question is from Blase B. MedSurg study tips and being able to point out and remember the difference between all of the many diseases we learn. Example, Cushing's versus Addison's, hypo and hyperthyroidism, or fluids and electrolytes, signs and symptoms, treatments, labs, interventions, etc. Things like that. Thank you. So with MedSurg, it's always something that sticks out about each different disease process that you can be able to differentiate. So let's take the example of Addison's versus Cushing's. So with Cushing's, you have too many steroids. So some characteristics of Cushing's disease that I've always remembered, they'll have that moon shaped face, kind of like that buffalo hump, and just think you have too many steroids. So what is your body gonna look like or do on too many steroids? Then with Addison's, that's not enough steroids. So think about your body not having enough steroids. What would some of the signs and symptoms be? So you'd get like anorexia, nausea, hypotension, and just with different things with the fluid and electrolyte balances, like how to differentiate between hyper and hypokalemia, hypocalcemia, hypercalcemia, and things like that. You just have to find the key feature that sticks out about each disease process to be able to help you differentiate which one is which. Some disease processes you might have to have a specific test that only applies to that disease process. So just finding the key characteristics or the key features of each disease process really helps with being able to figure out which disease process it is when you're taking these nursing exams. And then with the MedSurg, I did the same thing. So just, you know, PowerPoint, studying the PowerPoints, making flashcards, answering NCLEX style practice questions, you know, keeping a binder, keeping it organized. Yeah. Oh, and another piece of that question, when I would study my MedSurg, like the key characteristic that stuck out about like a disease process, I would always like make that in big colorful letters just so in my brain I could remember that. This question is from Miss Jasmine Elise Marie. She says, congrats on becoming a new RN. Thank you. I'm a CMA and I'll be going back for nursing. Here are my questions. What is the main challenge you faced becoming a nurse, and how long was the course? So the main challenge I faced becoming a nurse was probably just when I didn't pass a nursing course. So it was basically, in the end, it was just a minor setback for a major comeback, but I did not pass one of my nursing classes, and that set me back a whole year. So just going through that moment and, you know, feeling like a failure, feeling ashamed because I had to stay in college 5 years when people were graduating in 4. But, you know, now, you know, just look at me. You know, even though I failed that nursing class, but I passed NCLEX on first try. I had my dream job as a mother baby nurse. So probably failing one of my nursing classes. But, you know, I take sole blame for failing that class because in nursing school you have to have a different mindset when it goes to studying for tests, because coming from the prerequisite classes, some of the prerequisite classes I didn't have to study for those tests and I made an A. But you have to realize in nursing school you have to study, and the tests, they want you to critically think. Like in some of those prerequisite classes, like it was straight facts, you know, when it came to the tests. But in nursing school, those tests, they want you to be able to critically think. Like you need to be able to apply your knowledge to answer this question. And they're gonna like give you like different scenarios and everything. So just changing my thinking process and the way I go about with tests. So that was probably the biggest challenge I faced in becoming a nurse, but I'm here right now as a RN, so, you know, just a minor setback for a major comeback. I was thinking about doing a video about me not passing one of my nursing classes, just because I know there are people out there that may have not passed the nursing class and feel like it's the end of the world, but I'm proof right here by the grace of God that, you know, that wasn't the end of my story. So I think I might make a video about that. If you want to see a video about that, leave me a comment down below. Hopefully I'm not mispronouncing your name. Sorry if I am. Taria Jackie. Sorry. Can you explain what a labor and delivery, mother, baby, and nursery nurse duties are? Which nurse takes the baby after it's born and weighs it, gives it a bath, etc.? Labor and delivery nurses, they take care of moms during their pregnancy and until they deliver. Because I know at my hospital you'll have some moms come in at like 23 weeks because they might have been in a car accident, or they might have hyperemesis gravidum. I think I pronounced it right. Or things like that. Or you might have a laboring patient come in and, you know, they have to be trained on how to scrub for, like, not scrub, but they have to be trained on, you know, like C-sections and vag deliveries. And my job, which is mother baby nurse, I take care of moms and babies like 2 hours after delivery. And then maybe like 1 to 2 hours later, if there's no complications, they come upstairs. And yeah, I proceed to take care of them until they get discharged. So with mother baby, it's a lot of education, whether that's breastfeeding, safe sleeping, how to change diapers, and, you know, watching moms and babies for any abnormalities or anything like that. So with moms, you know, you're checking for hemorrhaging, infection. With babies, making sure they're not in any respiratory distress, you know, grunting, retracting, nasal flaring. You know, make sure their temperature is stable, making sure mom and baby vital signs are stable, and, you know, different things like that. Now, some hospitals, they have like postpartum nurses and nursery nurses. So the postpartum nurses, they take care of strictly moms. Nursery nurses take care of the babies, and they I pretty much do both, taking care of moms and babies. So when you think of postpartum nurses and nursery nurses, that's just the care is split up. There's a specific nurse for a baby, specific nurse for mom.